teach you about what is communication, uh, what is the definition of communication, and what is the process of communication, how communication will be processed, like from sender to receiver, how the communication process takes place, and what are the various types of communication. There are different types of communication, right? We can communicate message to receiver in different ways. So now we'll see what are those types, and what are the barriers of communication. So how the communication get hindered. So what can make the communication reach difficulty? So what are the barriers of communication? And next topic is what is health communication. So communication means any message, any topic or anything can get communicated, but in specific to health. So what is exactly health communication? We will discuss, and what are the various functions of health communication. And under that, one of the most important function is health education. So regarding health education, or how do you define health education? What are the aims and objectives of health education? And what are the approaches to teach this health education? So we will discuss all these things in detail in today's class. Okay. So first is, what is the definition of communication? What is meant by communication? So communication, it is a two-way process of exchanging ideas or feelings and information. It can be anything which is exchanged. It is basically a two-way process. Okay, you can exchange ideas, you can exchange feelings, or you can exchange information, or whatever it is. Okay, so that is called as communication. So in broad sense, it is refers to countless ways that humans have of keeping in touch with each other. The ultimate aim being to bring about change in human behavior. So that is the ultimate aim of communication. It is always it is aimed at bringing some change in the human behavior. So that helps. So that is the main aim of communication. So what are the various communication methods? So what are the communication skills? Usually the communication can be in the form of speaking, in the form of writing, or listening, or reading, or reasoning. So it can be of any ways. You can communicate your ideas to other person. So that's about communication. What is the main goal of communication? So the main purpose of communication is to bring change in a desired direction. So if you want to communicate any message to a particular person, the main goal is to get some change, to get some desired action, to get some good behavior out of that through the message. That is the main goal of communication. So the usually what ways the communication can change opposite person. So it can bring the changes in cognitive behavior of the person. It means that it improves the knowledge of the person. If you give some information to audience, so it affects the cognitive part. So that means it increases their knowledge. Next is the effective change. That means that you through communication we can change the behavior and also attitude of the receiver. Okay, that is an effective domain. Next is the psychomotor domain. Psychomotor domain means acquiring new skills through the communication, the whatever information you're going to give. Through that, people can acquire some new skills out of that. That is the psychomotor domain. So these are the three areas where the changes can take place. Okay, that is cognitive, effective, and psychomotor. Next, coming to the process of communication, how usually any message can get communicated from sender to receiver. So that process is called as process of communication. Usually what happens, whatever message you want to give, the message that is originated is from the sender. Okay, from sender the message gets originated, and that message reaches the receiver through any channel. Okay, so that is the process of communication. So the message can start from sender, it reaches the receiver, a channel. So that is a communication process. So these are the people, these are the things involved in a communication process: sender, messenger, message, channel, and receiver. The receiver, the last step is the feedback. You can see in this picture, the feedback is the message which goes from receiver to sender. Okay, whether the message is reached properly or not. To assess that, we use this feedback. So the feedback is the message which comes from receiver to sender. So that is about the communication process. So let's see all those, each one in detail. So first is the sender. So sender is a communicator, or is the source of information. Whatever information he wants to give, his sender is the main source, or he is the communicator. Okay, he is the one who originates the message. So usually the effective, any communication to be effective, the communicator should have the following things in his mind. Those are, his objectives should be clear. So whatever he wants to give the information, suppose he wants to create some awareness in the people, okay, some health education session he wants to give. He should set his objectives properly, and he should know the audience clearly. So to whom he wants to give the health education, he should know who are his audience clearly. And the message, so whatever message he wants to give, the message he should be clear and he is aware of it. Okay. And the channel of communication, so the which channel he is using for communicating the message is also important. And what are the abilities and limitations of the information? So what could be the limitations he can face, and what could be the abilities while sending the message? All these things we should be knowing well in advance. So these are the points which the sender should have, so to give a effective communication. The next is the receiver. So receiver is usually the audience who receive the message from the sender. So the receivers can be two types. One is controlled audience, and second is uncontrolled audience. So controlled audience are usually, we call them as a homogeneous group. That means they will have a common interest. Okay, so everyone stands on the same point. So they have same ideas. So that's called homogeneous group. Okay, so those audience are called as control audience. Next are uncontrolled audience, means they doesn't have any common interest. They just come and listen to your information out of curiosity. So they are called as uncontrolled audience. So there are basically two types: control audience and uncontrolled audience. So to say, for a good effective communication, more the homogeneity in the audience, more effective way you can communicate any information. So that's about receiver. So next is the message. So the message is nothing but the information which the communicator transmits to his audience to receive, understand, accept, and act upon. That means that it is basically, it's just an information which passes from sender to the receiver. That's called as message. A good message must be in line with the objective. So whatever message you want to give to the audience, it should be in line with objectives. Means it should match with the objectives whatever you have framed, and it should be meaningful, and it is based on their felt needs. And felt needs means it should be it should be based on the audience interest, what exactly they wanted. If you talk if you talk the information related to that, then only they will listen to you. That is called felt needs. And the information, the message should be clear and understandable. So it should be short and clear, and the audience can able to understand it properly. And it should be specific and accurate. That means the message should be specific to the subject and specific to the audience, and it should be accurate, clear. It means clear, and it should be timely and adequate, and it should fit the audience. That means that's what. So it should be based on their felt needs. So it has the message, means it has the right message has to reach the right audience. Next is it should be interesting also. So these are the good qualities a good message should have. So the right message should reach right people at right time. That is crucial. Okay. So next coming to the channels. So this is the fourth step in communication process. So you know the sender, you know the receiver, and all those things. So how this message will reach from the sender to a receiver? It is through a channel. So what is a channel? So basically channels can be three types. Okay, that is one is interpersonal. So interpersonal means it is like face-to-face communication. Means you will be giving the information by talking to a person, like face-to-face communication. That is called as interpersonal type. Next is mass media. You can also communicate the information through various media like TV, radio, printed material. These are all the different ways you can also communicate the message. Okay, that is another channel. So advantage of this mass media is you can reach so many people at a time. Okay, that is the main advantage of communicating the message through mass media. Next is folk or traditional media. This is another way of communicating channel. So here examples are folk dance, singing. These are the different types. Like if you see in rural areas, any message if you want to give it to people, so this is the best way you can communicate to the people because these have some cultural values which makes them understand better and the message can reach them effectively. So that is the folk or traditional media. That's another channel of communicating the message. So these are the three different types. Okay, one is face-to-face communication, that is interpersonal, then mass media and folk or traditional media. These are the three different channels of communication. So next is the last thing, that is feedback. So as I told you, feedback is nothing but it is the flow of information from the audience to the sender. So usually what happens, the message, whatever you want to give, that flows from sender to audience, right? So but feedback is the message that flows from audience to sender. Means so this message it gives you an idea about how much the audience receive your message. Okay, how much they understood whatever information you want to give, how much they could able to understand. So you get back some information from audience to the sender. So that is called feedback. So the message may be it gives you feedback either of the message can may be accepted or the message is rejected. So it also provides an opportunity to the sender to modify his message to render it acceptable. So with this feedback, usually the sender can able to understand whether the message reached correctly, whether the message is accepted by the audience or not. If the feedback is negative, means the message is not accepted by the audience. So he can get a chance or opportunity to modify it, and again he can give back the information. So that's the advantage of feedback. So that's about the communication process and what are the things involved in communication process. So next we'll move on to what are the types of communication. So what are the different ways you can communicate a message we'll see. So there are different types of communication. So one is one-way communication. It is also called as didactic communication. Then two-way communication is called as Socratic communication. Then it can be verbal or non-verbal communication. So formal and informal communication, then visual communication, then telecommunication and internet. So these are the various types of communication methods which we can use to communicate the information. So let's see these things. So first is a one-way communication. So one-way communication is also called as didactic communication. It's nothing but only the sender will be talking, okay, and the audience will be listening to the sender, okay. So best example is lectures in class. So I can give you another example like how I am taking the class. It is only one-way communication, right? So you people don't interact with me. It's only me who will be giving you the lecture. So that is the best example of one-way communication. So this method is also called as didactic method. So what happens here is the knowledge is imposed to the audience and learning is authoritative. So it is only authoritative. That means only I can able to talk. So I impose you the knowledge and there won't be any participation from the audience. Only the sender will be talking and the audience will just listen to the sender who gives the information and here no feedback. So obviously you people don't give me any feedback, right? Because you don't interact with me and you don't give me any feedback. Okay, and basically it doesn't influence any human behavior. That means that whatever lecture I'm giving you, I don't know whether you are receiving it properly, whether you are listening to me. I don't get feedback first thing and I don't get any interaction with you people. It is not an interactive session. So, and I don't know whether you people receive it in a good way or any change has happened. Means in that particular topic, whatever I'm teaching, whether you are able to gain some knowledge or not, I cannot assess. So that is the one-way communication, right? So next is the two-way communication. Two-way communication is usually it is a interactive session. So this method is also called as Socratic method. So this is basically an interactive session where both audience and the communicator or the sender they keep on interacting with the throughout the session. Okay, so the audience can raise the questions or they can they can share their own information with the communicator. So this is kind of interactive session. So here the process of learning is active and democratic. Okay, so people can actively participate in learning the information. Okay, so this is something like very active session. That like the previous one, the one-way communication, that is basically passive. People, whether we don't know whether they are learning, whether they are listening, or all those things. Okay, so this is two-way communication. So next types are verbal communication and non-verbal communication. So verbal communication is nothing but by talking we will communicate the message. Whereas non-verbal communication is it is without without talking also you can communicate the message, right, in the form of gestures, in the form of postures, by expressions, and all those things also people can understand what you are trying to tell. So that is called as non-verbal communication. So next other types are formal and informal communication. So formal communication is nothing but so following the lines of authority. That means the best example I give you. I'm doing the formal communication. So communication. I'm the authority. So I'm giving you some lecture, right? So that's the formal communication. And informal communication is you people when I'm taking the class, you people will be gossiping something informally, okay, to each other. So that's called as informal communication. So that's gossiping is called informal communication. So next is the visual communication. So visual communication means by looking at some pictures, we can understand the message. So okay, that's called as visual communication. Example is charts, posters, graphs, and all those things. So you can see here the picture and you can understand the message. Yeah, this is a pulse polio session, right? So that's about visual communication. So these are the various types of communications, various ways you can communicate the message. And one more is the last, that is telecommunication on internet. Through phone calls or through internet also, you can communicate the message. So that's about different types of communication. Next, coming to the what are the barriers of communication. So barriers means which obstruct or which hinders the communication process. That's called as barriers of communication. So there are different barriers for communication. One is physical barrier, then psychological barrier, then environmental barriers, then cultural barriers. So these barriers are broadly classified into four types: physical, psychological, environmental, and cultural barriers. So what is meant by physical barriers? So physical barriers are basically there will be a problem with the individual. Okay. So the way he expressed the things, the way some people cannot hear the information properly. Some hearing difficulties will be having. So it is an individual problem, okay? And some people cannot express the message properly. So that's why that will be difficult for communicating. So these are the barriers, comes under physical barriers. Okay. Next is the psychological barriers. So examples could be emotional disturbances, any worries, anxieties, or if a person has very low intelligence and if he has any comprehension difficulties, he also faces communication problems. So all these comes under psychological barriers. Next is the environmental barriers. So some disturbances in the environment can also hinder the communication process. So examples like if any excessive noise is there which is disturbing your communication, any congestion or any invisibility, if really anything like which is not clear, then also you cannot see any message that is written in the posters or anything. So that all comes under environmental barriers. Next are the cultural barriers. So cultural barriers also plays an important role in hindering the communication process, like strong beliefs, customs, attitudes, religious sentiments, literacy, illiteracy, economic and social class differences, language variations, cultural differences, urban versus rural, national versus foreign. That means even these cultural factors can hinder the communication process. Suppose if you want to give some health education to the good number of audience, because suppose in a rural area you want to create some awareness regarding some particular health topic, but people cannot accept some of the things due to their customs or due to their strong beliefs or any other cultural religious factors. That's how communication process will get hindered. So those comes under cultural barriers. So that's about various barriers for communication. So next coming to the important aspect, that is health communication. So till now we have seen what is meant by communication and how the communication process takes place and what are the types of communication and what are the barriers of communication. So here we discuss in particular about health communication, means in health system how the communication process helps for transmission of or for giving any information related to health. So that's called as health communication. So health communication, it is synonymously used with the word called as health education. So commonly we use this health communication in the in synonymous with health education. Health education is nothing but health communication. Okay. So this is an important area of communication as health is a concern of everyone. So how you communicate any message related to health, that is dealt under health communication. So health communication is also called as health education. So what are the various types of health communication? How do you communicate any health related things to the audience? So that can be done under these ways. That is through visual, means you can show the health information in the form of charts, graphs, maps or posters, and you can communicate the health information in the form of verbal, that is through word of mouth, and you can also communicate the health information in the form of telecommunication and internet, means through radio, TV or internet. Lot of health information can be communicated to the audience. So these are the various types you can communicate the health information. Next, the functions of health communication. So what are the various functions of the health communication? So it caters the following needs. So it gives the information, it educates the people, and it motivates the people, and it persuasion means winning. Okay, kind of winning the hearts of the people, like that. And I will discuss that later. And counseling, rising morals, health development and organization. So these are the various functions of health communication. So let's see these things. So first is the information. So health communication plays a primary role in giving information to the people. Okay. giving information related to health to the people regarding their health problems and how to maintain the health and how to promote the health. So it mainly helps to give the information. The health communication is the primary function of health communication is give the information, right information regarding the health to the people. And also it eliminates the social and psychological barriers about the health matters and it increases the awareness of the people. So by giving the information, it increases the awareness of the people regarding the health. And also it influences the people about needs and demands. So what is need for them and what is like the demands, all these things gets influenced with the health information. So next is the education. So this is one of the most important function of health communication. So by giving health education, we can change the behavior of the people like in a positive way. So we can impose the knowledge. We can impose the knowledge related to health information, like how the disease can transmits or how the disease can come, how it transmits, what are the various symptoms, and how can you prevent. All these things only we can do by doing a good health education. So it is an integral aspect in the prevention oriented approach. Means it helps you to for in any aspect in disease prevention. That's why it is a preventive oriented approach. So health education is a prevention oriented approach. It helps to prevent so many various diseases by simply giving a health education, by simply giving health education or by simply creating awareness to the people. Okay, it brings about changes in their lifestyle and thereby risk factors of the disease. So by giving some good health education, you can definitely bring the changes in their lifestyle. So whatever lifestyle changes we require in different diseases, especially non-communicable diseases. It is only possible through health education. In that, in terms, help you to reduce the risk factors for any disease. And health education is a very cost-effective method. Okay, you can prevent lot of diseases at the earlier stage by simply doing a good health education. So I will discuss the health education this topic in detail in the later classes. So next function is the motivation. So health communication helps in motivating the people. So what is meant by motivation? So motivation is a power that drives a person from within to act. Means it improves the it is a power, okay, which drives a person from within to act. Means something like it motivates a person to act in an effective manner. So it assists individual to the final stage of decision making and adoption of new ideas or program. Suppose you want to create you want to make a person to listen to you regarding one good health topic. Okay, so the way you communicate, the way you motivate a person, he can able to accept the information, health information, whatever you want to give, and he will also adapt that idea. Okay, so that is called as motivation. Suppose I give you one example for better understanding. Suppose you want to motivate a person for quitting smoking. Okay, so you give him a good motivation session through health education. So in such a way that the person can understand his what are the side effects of smoking and all those things. He will understand your idea. Okay, smoking can cause us injury, okay, to the or causes some lung diseases and also he will understand your idea, he will accept your idea, and he also adapt the idea of quitting the smoking. So that's called as motivation. So next is persuasion. So persuasion is a little bit different from motivation. So it is an art of winning friends and influencing people. So that means that same example, quitting smoking. So the way you communicate the message to the person, either two things can happen. Either the person can accept your message or he can reject the message. That means whether he will get convinced with your message by not by quitting the smoking, he may not do that. Okay. So it is persuasion is an art of winning friends or influencing people. Means suppose if he accept your idea, okay, yes, I have to quit the smoking. So that means that he got influenced, okay. So you want his heart, okay. So that's called as persuasion. So it is an art without forcing or manipulating the person. So it is the way you communicate, okay. That means nothing but the smart way you make the people convinced to the particular thing. That is called as persuasion. So it is never by force or by manipulating. You are not doing any manipulation over there. So that's called as persuasion. So the persuasion can change lifestyle and modify the risk factors of the disease. So that's what I told you just now. So there is a difference between persuasion and propaganda. So propaganda or brainwashing, that is another term. There is a slight difference between these two things. So propaganda or brainwashing is nothing but where you forcefully make a person to change even if he is not interested to do that. So that is called as propaganda or brainwashing. So when such techniques are deliberately employed to manipulate the feelings. So you are manipulating the feelings of the person, though he is not interested. So you are forcing him to change. So that is nothing but propaganda or brainwashing. So persuasion is different from propaganda or brainwashing. So that's the difference. So next function is counseling. So counseling is one of the most important function of health communication. So counseling, it is a process that can help people understand better and deal with their problems and communicate better with whom they are emotionally involved. So wherever if any tough situations are there, so you may require counseling. Suppose if any psychological problems are there, so the counseling plays a great role. The way you interact with the person, it is actually different from advising. So advising means you just tell something to the person good in a good way, whereas counseling is it is something like beyond advising it, okay. So it is just implies choice, it is not actually forced. So, what are the important things a counselor should have? So, basically, he should have these following good things. Okay, examples like he should be a good communicator and he should gain trust of the people. Suppose to be a good counselor, first he should have a he should be a good communicator. Okay, he should able to communicate the message properly. Okay, whatever he wants to tell. And second is he should gain trust of the people. So he should first gain trust from the opposite people who are come for counseling. First, the person should trust the communicator. Okay. Next is he should be sympathetic listener. That means the communicator should patiently listen whatever the opposite person is saying, his problems, whatever problems he has, whatever he says, he should able to listen patiently. So that is a sympathetic listener. And he should be empathize, understand person's feelings, and make the later feel free to express. Means the communicator should be have patience and he should able to understand the opposite person's feelings, and also he should make him feel free to express whatever problem he has. Okay, so that is another thing, and he should help reduce or resolve problem. Ultimately, at the end, he should be able to resolve the problem whatever the opposite person has. So these are the qualities a good counselor should have. So this is important question for you. It's a short notes. What is counseling and what are the qualities of a counselor? So this is a short notes for you. So next function is rising morale. So rising morale usually it means that the health communication has a capacity of improving, like it is nothing but the capacity of a group of people to pull together persistently or consistently. That means whatever information, if suppose if a group of if a group of people want to do a task, okay, so it is something like self-boosting. So all together, together boost themselves. Okay, that is called as rising moral. So you can see here in the picture. Okay, so that's called bringing together and doing things effectively, like together and boosting themselves. Okay, that's called as rising moral. Next is health development. So communication can play a role by helping to diffuse knowledge to the people, obviously. So through health communication only, people can receive lot of good knowledge. So they pursue the good knowledge through health communication. So lastly, that is health organization. So health communication plays very important role in health organization, and whatever health communication is there, that can pass through in various directions in health organization. It can the health communication can pass either in vertical direction or horizontal direction in the entire health organization. So these are the various functions of health communication. So that's about health communication. So next we'll move on to important topic, that is health education. Okay. So as I told you, this is one of the function of health communication, and the starting I told you, health communication is a the health education is synonymously we use this word in place of health communication, right? Let's see what is health education. So health education is one of the functions of health communication. It is the foundation of preventive healthcare systems. As I told you, health education plays very important role in prevention of various diseases, right? So you can give a lot of health education sessions to the population to change their behavior, to change their healthy habits, I mean, to change their lifestyles, okay, lifestyle modification for various kinds of diseases. All these are done only through health education. So this is a very commonly used term by health professionals, right? We use this health education as a very common term, right, in our daily routine. So coming to the definition, what is the proper definition of health education? So health education is a process aimed at encouraging people to want to be healthy. So through health education, what we do is we encourage people to want to be healthy, to know how to stay healthy. We also tell them how to stay healthy and to do what they can individually and collectively do to maintain their health and to seek help when needed. So health education is a process aiming at encouraging people to want to be how to be healthy, how to stay healthy, and what they can do individually and collectively to maintain their health. Okay, so all these can be done through health education. So this is the definition given by Alma Ata. Next, coming to the what are the aims and objectives of health education. So what the ultimate aim of health education is to bring a positive behavioral change in a individual. Okay, ultimately the health education aims to bring some behavioral change, that is positive behavioral change in a particular individual. So health education imposes knowledge, so that knowledge can aim to change the attitude of the individual. So usually in a positive way, and then that can change the behavior of the individual. So that is the process of health education. The ultimate goal or aim of the health education is to bring a positive behavior in a individual. That means, as I told you before, also the example, if you want to make a person quit smoking through health education, only you can do that. Okay, so suppose he by listening to you, a person can quit smoking. That means you are changing the behavior of the person in a positive way. So that is the simple sense. Coming to the objectives, so there are what are the objectives of health education? The first objective is to encourage people to adopt and help promoting lifestyles and practices. So that is the first objective. So the first objective is you make the person to change their lifestyle. So it mainly helps to help in promotion of or promoting the lifestyle changes and their practices. Next objective is to promote proper use of health services. So through health education, you can promote people to use or access to health services. What are the health services available and how can they access to health services? That is done by through health education. Next is to arouse interest, provide new knowledge, improve skills, and change their attitudes in making rational decision to solve their own problems. That means, so the health education has allow you to create interest regarding new knowledge. Means it improves new knowledge in a particular place, particular area, and that improves the skills, and they also that also make person to change their attitudes, and also it makes the person to take their individual decisions, okay, to solve the problems in their own style. So that is another objective. Next is to stimulate individuals and community self-reliance and participation to achieve health development through individual and community involvement at every step to identification of problems to solving them. So the health education also helps you to make people participate. Okay, that is called nothing but community participation. Okay, it is for example, suppose I give you an example to understand this objective. There is a lot of open defecation is followed in our country. So you want to bring some change in individuals to change their attitude of doing this open defecation by simply giving health education sessions on what are the side effects of open defecation, what are the diseases which can transmit through open defecation. So you will tell various things regarding that, and you will make them understand utilization of sanitary latrines. Simply by constructing sanitary latrines, we can prevent so many diseases which can transmit through feces. So we will make them educate through health education. Okay. So suppose only if one individual listen to you, so then your problem is solved? No. So it is nothing but whole the community has to listen to you, and they should practice using a sanitary latrine. So it is only that means that your information, whatever is there, that should reach the larger community. Okay. So all the community people, the whole community should participate, and they should make it. They should come to a decision, and they should agree with you to use the sanitary latrine. So that is called as community participation. So they all should participate, and all should involve, and all should accept your idea. So that is called community participation. So those are the objectives of health education. So next is what is the role of healthcare providers? So how the healthcare providers can communicate or give the health education. So these are the people who actually give health education. It is mainly the communication is processed through healthcare providers only to the community. Okay, so they provide opportunities to learn how to identify problems, analyze, set own targets and priorities. So these people helps and give the opportunities sorry, to learn how to identify problems by the community and how they can analyze their own problems, and all those things they will only tell. Next is make health and health related information easily accessible to all. So through healthcare providers only, whatever health information is there, that will be easily accessible to the community. And they indicate alternate solutions for solving health related issues. So they also helps to provide alternative solutions to the community for solving any health related issues. And people must have access to proven preventive measures. They also give a chance or educate people how to, what are the various preventive measures available to them, how to access to those measures. These are all can be done by only healthcare providers. So healthcare providers can be best example for healthcare provider is ASHA, who is available to the community right next to them. Okay, in the villages. Example is Asha. Okay, so that's about role of healthcare providers. Next, coming to what are the various approaches to health education. That means that how can you give health education to a community? So what are the various approaches we used, okay, for reaching the message to the community? So the approaches can be regulatory approach, service approach, health education approach, and primary healthcare approach. So let's see all these things in detail. So first is the regulatory approach. So regulatory approach is nothing but we use different approaches for educating the people because we follow different approaches because each message, each health message cannot be delivered in a same manner. Okay, so we have to follow different approaches to deliver different kinds of health messages. Okay, so under the first one is the regulatory approach. So regulatory approach is nothing but any government intervention, either is direct or indirect, which is designed to alter the human behavior. So this is basically regulatory means authority. Okay, some authority is there. Somebody is taking it as an authority. Okay, example here is the government people. So government people are giving some rules. Okay, they are putting some rules to make you understand better. So some rules or regulations or legislations or laws, those are put by government people. So that comes under regulatory approach. So the rules or regulations can be in the form of prohibitions to imprisonment. So it can be either prohibition or it can go up to imprisonment. Okay. So these are the rules which are framed by the government people. So that approach is called as regulatory approach. So I tell you some examples for this. So examples are, first one is Child Marriage Restraint Act in India. So that is a legislative, it is a rule, okay. It is a authority, like the authority government has made a set up a rule, okay, that the child marriages are banned. Okay. So that is a health message which government is giving in the form of authority. Okay, that is called as regulatory approach. The second example is compulsory seat belts in Western countries. So this is also a rule framed by the government. So through by an authority, okay, by regulating the people. So that's called as regulatory approach. So the advantages of this approach is it is simplest and quickest way to improve the health. Okay, these are like framing the rules means you have to do means you have to do that. If you don't do, you will be punished for that. So that's called as regulatory approach. Next, the disadvantages with this approach is you cannot put this approach everywhere. You cannot demand people to do this particular thing in every aspect. So best example is suppose you can tell people to wear seat belts, but you cannot tell people to eat balanced diet. So that is their individual choice. Okay, they may eat balanced diet or they may not eat balanced diet. So you cannot impose them or you cannot force them. You should eat balanced diet. Okay, so in such cases you cannot put this regulatory approach. So regulatory approaches are put only on particular areas. Example, as I showed you wearing seat belts, wearing helmets. These are all comes under regulatory approach. So next is service approach. So service approach is nothing but you will be giving some free service to the individuals. So aimed at providing all health services needed by the people at their doorsteps means when you just give some benefits or health services to the individuals right at their doorsteps, okay, through this service approach. But the service approach is failed badly in certain areas. The best example is water seal latrines provided by government for free of cost in rural areas. So what happened here is, so, whenever you are giving some health education or whatever, it should be based on felt needs. So felt needs means I already told it should be based on the audience interest. So here what happened is the water seal latrines were provided by government for free of cost. Though they are provided it for free of cost, and they have provided to each and every individual at their doorstep, but people didn't accept it. Okay, because they felt it is not required for them. They felt it is not needed for them. So that is the way the service approach is failing. So from this, what lesson is learned is always whatever information or whatever health services you are giving to the people, it should be based on their felt needs. It should be based on their interest. Okay, that's called. That's about service approach. Next is health education approach. So health education approach is a better approach than the previous ones. So people must be educated through planned learning experiences, what to do, and be informed, educated, and encouraged to make their own choices for a healthy life. So the way you teach, the way you give health information through health education, it is based on their interest, and also you should make them have some change through the message, and also they should able to analyze by their own, and they can able to solve the problems by their own, which helps to which helps in modifying their lifestyle. Okay, so that's about health education approach. So through this approach, many problems will be solved, like cessation of smoking, use of safe water supply. All these things can be solved through health education approach only. So you cannot put a regulatory approach here. You cannot say an individual you should quit smoking. People don't way that tell in such a people can able to understand. So what are the consequences of it, and the way you give the message is very important. So that is a health education approach. So health education should be started with young population. So when whatever health education you are giving, that should always start from the young individuals, because when the individual is small, okay, then only during the small age only their attitudes and behavior patterns, everything will get formed, okay, during the early stages of life. So that's why it is always important to give health education at right from the young age itself. Okay, suppose if you want to give health education regarding obesity, so it's right to go. It's right wise advice to go and give your health education session to school children, because that's the age where the attitudes and behavior patterns will be formed. So there they effectively listen to you, and you can get the maximum benefit out of it. And but the results are slow, but they are good. Okay. So the best way of giving health education to reach larger group of individuals are larger community are through mass media and social organization. So this will really helps to spread or distribute the health education or information to a larger area. It's only through mass media and social organizations. And the last approach is primary healthcare approach. So primary healthcare approach is slightly different from health education approach. Here we make sure that people's participation. As I give you one example, right? At the beginning, the community participation for open edification. I told you, if you only change only the individual, okay, the problem won't be solved. It is only through the whole community should get convinced with your message, and the whole community should participate. Whatever change you want to bring in them, okay, that is called as community participation. Okay, so it's a new approach starting from people with their full participation and active involvement in planning and delivery of health services based on principles of health education. Okay, that's about primary healthcare approach. So next, the last topic, that is health education versus propaganda. So what is the difference between health education versus propaganda? We should know. So health education is basically, it is not a propaganda. It is more than mere information or propaganda. I told you in the beginning what is meaning of propaganda. Propaganda means you are imposing or forcing a person to do some change. Okay, if you are telling something, you make the person to you forcefully make a person to change. Whereas health education is not like that. It is just you will be giving an information and you will try to bring a new change, or you try to get a positive behavior from them in a different way. It is not by force. Okay, that's the main difference between health education and propaganda. Okay, so let's show you the difference between these two. So health education and propaganda. Health education is basically the knowledge and skills are actively acquired. So they acquire the knowledge and skill actively. It is not through force. Whereas propaganda, whatever information, knowledge or skills the people acquire, it is mainly by force. We forcefully insist the people to either learn or induce the knowledge into the minds of the people. It is through force. Health education makes people think for themselves. Whereas propaganda, you don't give any chance to think. Okay, it is because it is just by force you are putting things into their minds. Okay, so it prevents or discourages thinking by ready-made slogans. So we just give straight away some slogans and people has to follow it by force. So that's about propaganda. And health education, it is a discipline's primitive desires, whereas propaganda, it arouses or stimulates. Okay. Next, health education develops reflective behavior, trains to use judgment before action, whereas propaganda develops reflexive behavior, aims at impulsive action. Okay. Next, health education appears to reason, so it appears to be emotional. Okay, emotionally we blackmail or literally force people to listen to what you want to impose information. Okay, next, health education develops individuality, personality, and self-expression. So here the people can able to express their own ways, and it also helps to develop their individuality and personality. Whereas propaganda develops a standard pattern of attitudes or behaviors according to mold used. Okay, so here what happens? You have already framed certain slogans or certain things. So you expect people to go in the same way. Okay, you cannot make a person express himself like self-expression. You don't give chance to them. Okay, so that's about propaganda. Next, health education. Knowledge in health education, the knowledge acquired through self-reliant activity. Okay, whereas here in propaganda it is spoon-feed kind of thing. Okay, the passively they receive the message. They cannot think their own because we don't give chance to think them by own. Okay. Next, health education is a process, is a behavior centered. Okay, mainly we target to change the behavior of the person. Whereas the propaganda, it is mainly based on information centered. Okay, here means we don't expect any behavior change. We don't give chance to person to change the behavior. Here we just impose the information. Just you have to make the people listen to you and just impose the information to them. It is not behavior center, whether their behavior changed or not changed. That's not important in propaganda. So these are the main basic differences between health education and propaganda. So this is another short notes question for you. So that's about today's class. So next class, we will continue some more topics under health education, like what are the models of health education, principles of health education, and practice of health education. So that's about for today. Thank you.